The November wind howled through Chicago's streets, rattling the ambulance bay doors of Northwestern Memorial Hospital's emergency department. Inside, fluorescent lights hummed over chaos, beeping monitors, hurried footsteps, and the metallic smell of antiseptic mixed with blood. It was 11:47 p.m. on a Tuesday, the witching hour when exhaustion met desperation. Dr. Marcus Webb had removed his hospital identification before leaving his office on the 7th floor. The sleek leather wallet containing his credentials sat locked in his desk drawer. What had started as sharp discomfort in his abdomen during the evening budget meeting had evolved into something far more sinister. Now, dressed in his charcoal Tom Ford suit and Italian leather shoes, he stumbled through the automatic doors, clutching his side. The triage nurse, Kelly Morrison, barely glanced up from her computer screen. Her 12-hour shift was bleeding into hour 14, and the waiting room held 17 patients. A gang shooting on the south side had flooded the ER 2 hours earlier. "Name," Kelly said flatly. "Michael Warren," Marcus managed, using his middle and confirmation names. Sweat beaded on his forehead. "What's the problem?" "Severe abdominal pain. Started 6 hours ago, getting worse." Kelly's eyes flicked over him. Expensive suit, Rolex watch, no visible blood or trauma. Another businessman who ate too much deep dish pizza. "Any nausea, vomiting, fever?" "Some nausea. The pain is—" Marcus doubled over, gripping the counter. The pain was like a white-hot knife twisting in his lower right abdomen. On a scale of 1 to 10? 9, maybe 10. Kelly typed without urgency. In her experience, everyone claimed their pain was a 10. "Take a seat in the waiting area. We'll call you when a room opens up." Marcus wanted to argue, but something stopped him. Perhaps it was simple curiosity about how his own emergency department functioned when no one knew who was watching. He took a plastic chair between a woman cradling a feverish toddler and an elderly man with a nasty gash on his forearm. The chair was cold, hard, and sticky. On the wall-mounted television, a late-night talk show played. The laugh track seemed obscene. Marcus checked his watch. 11:52 p.m. The pain pulsed with each heartbeat, radiating from his lower right side. He knew the symptoms. He'd diagnosed appendicitis hundreds of times during his residency. The rebound tenderness, the migration of pain. Classic presentation. But he was just another number in the queue. Through the security glass, he watched his emergency department function. Resident physicians in wrinkled scrubs rushed past. Nurses clustered at the station, discussing weekend plans while monitors beeped. A janitor mopped blood from the floor. At 12:03 a.m., a man in a business suit was brought in by his panicked wife. Kelly triaged him quickly. "Chest pain?" she asked. "Yes. Feels like an elephant sitting on me." Kelly's demeanor transformed. "We're taking him back immediately. Possible MI." Marcus watched as the man was rushed through the doors. Protocol was being followed. Chest pain trumped abdominal pain every time. But Marcus had seen the man's color, his breathing pattern. Anxiety attack, not cardiac. But the protocol demanded immediate response. Meanwhile, Marcus's appendix was quietly dying. At 12:17 a.m., a teenager stumbled in with friends, reeking of alcohol and vomit. Kelly sighed and assigned him to the waiting area. The boy promptly vomited on the floor. No one came to clean it for 8 minutes. Marcus felt his own nausea intensifying. The pain had shifted, becoming more localized. He pressed gently on the spot and nearly blacked out. Definitely appendicitis. Possibly progressing to rupture. At 12:24 a.m., his name still hadn't been called. A young resident, Dr. Sarah Chen, emerged from the treatment area, stifling a yawn. She scanned the waiting room with exhausted eyes. Her gaze passed over Marcus without recognition. "We need to move faster," she said to Kelly. "I'm triaging as fast as I can." Kelly snapped back. "Maybe if we had adequate staffing." "Not my problem. Just get them processed." The exchange took 45 seconds. Then Sarah disappeared, and nothing changed. Marcus closed his eyes, breathing through the pain. Every inhale felt like broken glass in his abdomen. At 12:31 a.m., a mother brought in a screaming child with an earache. Kelly triaged her ahead of Marcus. Pediatric cases got priority, but Marcus had now been waiting 39 minutes with a potentially life-threatening condition. The elderly man's bleeding had stopped, but his bandage was soaked through. The drunk teenager had fallen asleep and was snoring. Marcus's watch read 12:37 a.m., 40 minutes. His vision was starting to blur at the edges. The pain had evolved beyond sharp. It was now a consuming fire. He could feel his body shutting down. And then, with a calm that surprised even himself, Marcus Webb stood up. The movement sent lightning through his abdomen, but he straightened slowly, deliberately. He took 3 measured steps toward the triage desk. Marcus placed both hands on the counter and spoke in a voice that cut through the chaos. 40 minutes. Kelly held up one finger. Wait your turn. I have been in your waiting room for 40 minutes with acute appendicitis, likely approaching rupture. During that time, I've watched 17 people receive care, 5 of whom had less urgent conditions. I've observed protocol violations, communication breakdowns, and a systematic failure that would be embarrassing if it weren't potentially fatal. Kelly finally looked at him, irritation flickering across her face. Sir, I understand you're in pain, but I'm not finished. Marcus's voice remained calm, but something in his tone made Kelly stop, made everyone stop. In the past 40 minutes, no one has checked on patients in this waiting room. The elderly gentleman in chair 7 has been bleeding through his bandage for 20 minutes. The woman with the toddler told you her child had a fever of 104. That's a pediatric emergency, and the drunk teenager just stopped breathing. Every head turned to the sleeping teenager. His chest was still, too still. Oh my God, Kelly whispered, already moving, calling for help. A code team rushed out. Marcus continued, never wavering even as he swayed on his feet. Doctor, Jen violated hand hygiene protocols multiple times. The janitor who cleaned the blood spill used the same mop he'd just used in the bathroom. Your crash cart in Bay 4 is blocking the emergency exit. Sarah Chen emerged during the commotion. She stared at Marcus, confusion and anger on her face. Who the hell do you think you are? Marcus reached into his jacket pocket, slowly, and pulled out his hospital ID badge. Dr. Marcus Webb, hospital director, and your patient. The emergency department froze. Absolute complete silence except for the desperate resuscitation efforts. The shock rippled through the emergency department. Nurses stood paralyzed. Dr. Sarah Chen's face cycled through disbelief, horror, and panic. Kelly Morrison's hands hovered over her keyboard, frozen. Dr. Webb remained standing, though his knuckles had gone white where he gripped the counter. Sweat darkened his collar. Dr. Webb, Sarah Chen started, then stopped. Get me a gurney, Marcus said quietly. Now. 3 nurses moved at once. Within seconds, a gurney appeared. As they helped him onto it, Marcus kept talking. The teenager. Status? Pulse is back, called the nurse, doing compressions. Respiratory depression from alcohol poisoning. We're bagging him now. Good. Get toxicology and call his parents. Marcus gritted his teeth. Kelly, re-triage everyone in that waiting room. Use actual clinical judgment this time, not just protocol checkboxes. Yes, Dr. Webb, Kelly whispered. They wheeled Marcus into Bay 5. Dr. Jeffrey Holden, the attending physician, appeared beside the gurney. His face had gone the color of ash. Marcus, Jesus Christ. Just treat me, Jeff. We'll discuss the systemic failures later. Jeff's hands shook as he began the examination. Gentle palpation of the abdomen. Rebound tenderness that made Marcus hiss. How long have you had symptoms? 6 hours. Pain started around 5:30 p.m. Periumbilical initially, migrated to right lower quadrant around 8 p.m. Why didn't you come to the ER immediately? I wanted to see how the system would handle an unknown patient. Marcus managed a grim smile. Turns out, not well. Sarah Chen stood at the foot of the gurney. Dr. Webb, I'm so sorry. You followed protocol. That's appropriate. But protocols aren't enough. Clinical judgment requires actually looking at patients, seeing what's in front of you. Jeff was already moving. CBC, BMP, get a CT with contrast, page Dr. Morrison in surgery, and get anesthesia down here now. Jeff, Marcus said, catching his arm. The pain is getting worse, sharper, more diffuse. Jeff palpated again, and Marcus nearly came off the gurney. Rigid abdomen. I think it's already ruptured. Sarah, call surgery. Perforated appendix. Possible peritonitis. This is now a surgical emergency. The bay exploded into controlled chaos. IVs went in, blood was drawn. But Marcus kept watching. No one checked on the elderly man with the bleeding arm. No one followed up on whether Kelly had re-triaged the waiting room. Jeff, Marcus said through gritted teeth, what's the teenager's status? Jeff looked confused, then guilty. Assign someone to check and report back, and implement a waiting room monitoring protocol immediately. Every 15 minutes, a nurse does a walkthrough. Marcus, we need to focus on you. I am focusing on me, and on every other patient in this building. Marcus's voice was weakening. Someone needs to find the teenager's emergency contact. Sarah Chen stepped forward. I'll do it, and I'll implement the monitoring protocol tonight. Thank you. Marcus studied her. How many hours are you into your shift? 29 hours. When were you supposed to end? 7 a.m. Marcus looked at Jeff. Why is a resident working a 36-hour shift when we implemented restricted duty hours 3 years ago? Jeff's silence was answer enough. That gets fixed. Tomorrow. He paused as another wave of pain hit. But first, someone needs to get me into surgery. Dr. Helena Morrison arrived at a run, still in street clothes. She looked absolutely horrified. Marcus, how long have you been symptomatic? 6 hours. Ruptured within the last 30 minutes. Helena's jaw tightened. She began her examination. We need to operate immediately. I need you at your best, Helena, not panicked. I'm not panicked. You're gripping the gurney hard enough to leave marks. Breathe. I'm just another patient. Helena did breathe, visibly forcing herself to calm. You're right. Let's move. As they began wheeling Marcus toward the elevator, Kelly Morrison appeared beside the gurney. Her eyes were red-rimmed. Dr. Webb, I re-triaged the waiting room. The elderly man needs stitches. We're taking him back now. And I found 2 patients who should have been fast-tracked and weren't. I'm so sorry. I got complacent. Marcus reached out, wincing, and briefly touched her hand. Complacency kills, Kelly, but so does blame without learning. You made mistakes tonight. So did everyone else. The question is whether we learn from them. Can you promise me you'll learn? Yes, she whispered. Then we're good. Now get back to work. The elevator doors closed. Marcus lay on the gurney, fluorescent lights streaming past. Helena walked beside him, monitoring his pulse. You know, Marcus said, his voice drifting from the drugs, I always wondered what it felt like to be a patient here. You can't really know until you're the one waiting, hurting, hoping someone will care enough to notice. We noticed, Jeff said quietly. You noticed when you learned who I was, but I shouldn't have had to be someone important to receive appropriate care. That's the problem. Every patient deserves what I got once you knew. We forgot that tonight. We won't forget again, Helena promised. The elevator opened to the surgical floor. As they transferred Marcus to the operating table, he caught Helena's eyes. Helena, I need you to promise me something. Anything. Don't go easy on them. Not me, not anyone. Whatever review process needs to happen, let them happen. The only way we fix this is if we face it honestly. Helena nodded. I promise. Now let's save your life. The anesthesiologist placed the mask over Marcus's face. Count backward from 10. 10, 9, 8. Marcus's last thought before darkness took him was of the waiting room, of the teenager who'd almost died because no one had been paying attention. 7, 6. He never made it to 5. Marcus Webb woke to the antiseptic smell of post-operative recovery and distant beeping. His throat was raw from intubation. His abdomen felt like it had been used for kickboxing practice, but he was alive. The recovery room was quiet, dimly lit. Through the window, he could see the Chicago skyline beginning to lighten. 4:47 a.m. "You're awake." Helena Morrison sat beside his bed, still in scrubs. She looked utterly exhausted and profoundly relieved. "How bad?" Marcus managed to croak. "Perforated appendix with early peritonitis. Another hour, and we'd have been looking at sepsis." Helena's voice was steady. "We did a laparoscopic appendectomy, irrigated extensively, started antibiotics. No complications during surgery, but infection risk is significant. Prognosis? If no complications develop in the next 48 hours, full recovery expected in 4 to 6 weeks. Helena leaned forward. "Marcus, you came very close to dying. If you'd waited even another 30 minutes... But I didn't, and that's the point." Marcus tried to sit up, immediately regretted it. "What happened after I went under?" "What do you mean?" "In the ER. What happened?" "I don't know. I was focused on you. Find out. I need to know everything. The teenager, the other patients, how the rest of the shift went. Marcus, you just had major surgery, which gives me 6 weeks of recovery to address what happened. If I wait too long, people will think I've let it go. But if I move too quickly, they'll think I'm acting out of anger rather than principle." He paused. "So I need information now." Helena studied him, then nodded. "I'll make some calls." She returned 20 minutes later with a tablet. "I spoke with Jeff Holden and the night supervisor. What do you want first?" "Start with the teenager. Tyler Martinez, 17, blood alcohol content of 0.24. Respiratory depression, stopped breathing for approximately 90 seconds before the code team responded. They got him back, intubated him, currently stable in the ICU. Parents were notified. They're considering legal action." Marcus closed his eyes. "Document everything. The failure to monitor the waiting room nearly killed him. That's on us. System failure." "Agreed." Helena scrolled down. "The elderly man, George Pritchard, 73, the cut on his arm had severed a small artery. He'd lost enough blood that his pressure was dropping. Stabilized, 18 stitches. Admitted for observation. He sat there bleeding for over 30 minutes. Closer to 45. Helena's voice was flat. Marcus felt anger building but forced it down. "Continue." "The woman with the toddler, Ashley Rodriguez's daughter Emma. Emma's fever was 104.2 when they finally took her back. Ear infection, but at that temperature, they should have been taken back immediately. Kelly's assessment missed several red flags." "Such as?" "The child was lethargic, not responding normally. The mother reported decreased fluid intake, signs of potential serious illness, but Kelly documented it as fussy child with low-grade fever." Marcus absorbed this. "What else?" Helena's expression grew more grim. "After you went up to surgery, Sarah Chen implemented the 15-minute waiting room monitoring you suggested. On the first walkthrough, she found a 62-year-old woman having a stroke. Classic presentation, facial drooping, slurred speech, right-sided weakness. The woman had been in the waiting room for 53 minutes. The anger Marcus had been suppressing erupted. 53 minutes? What was her triage presentation? Headache and dizziness. Kelly categorized it as non-urgent, suggested it might be migraine-related. Helena met his eyes. The woman had no history of migraines, and no one noticed she was actively stroking until Dr. Chen's walkthrough. Can we still treat her? She received TPA at 1:43 a.m., approximately 75 minutes after symptom onset. We're within the window, but the delay significantly impacts prognosis. She's currently in the neuro ICU. Marcus was silent. A stroke patient, a bleeding patient, a child with dangerously high fever, a teenager who'd stopped breathing, and him, all in one night. How many staff were on duty? 2 triage nurses, including Kelly. 3 floor nurses, 2 residents, 1 attending, plus support staff. And how many patients came through? 63 total presentations over 12 hours. So we were understaffed. We are always understaffed, Helena said quietly. I know. Marcus looked at her directly. I'm part of the administration that's been pushing budget cuts. I signed off on the staffing models. This is on me too. You can't blame yourself. I absolutely can and will. I got complacent too. I looked at spreadsheets instead of spending time seeing what's actually happening. He paused. What's the complication rate? Near misses? Incidents that didn't result in death but could have? Helena's silence was damning. We don't track that carefully, do we? Marcus continued. We track what we have to for accreditation, but the near misses, those fall through the cracks. What are you going to do? I'm going to burn it down and rebuild it correctly, Marcus said flatly. Not the people, the system. A knock interrupted them. Jeff Holden entered, looking like he'd aged a decade. Behind him came Sarah Chen, Kelly Morrison, and Patricia Williams, the night supervisor. They stood in a ragged line, none meeting Marcus's eyes. Dr. Webb, Jeff began, we wanted to check on you. Sit down, all of you. They sat. Kelly was crying silently. Sarah looked defiant and terrified. First, Marcus said, let me be clear. I'm not firing anyone. What happened last night was a system failure, and system failures are leadership failures. My failure. The relief was visible, but tentative. However, Marcus continued, what happened can never happen again. And that means everything changes. The staffing model, the triage protocols, the monitoring procedures, all of it. What do you need from us? Patricia asked. Truth, Marcus said simply. I need absolute honesty about what's not working. No covering, no minimizing. I need you to tell me every shortcut, every workaround, every time you've thought this isn't right, but didn't say anything. Sarah Chen spoke up. We're drowning. Every single day. The 36-hour shifts aren't supposed to happen, but they do, because we can't get coverage. We cut corners, because if we didn't, we'd never get through the patient load. We triage by protocol instead of clinical judgment because protocols protect us legally, and things go wrong all the time. We just don't talk about it. Keep going. The equipment is outdated. Half the monitors don't work properly. One crash cart has been broken for 2 months. The waiting room monitoring you suggested? We used to do it, but it got cut 3 years ago because we didn't have enough staff. Jeff added quietly, we've been bringing these issues to administration for years. Nothing changes, so eventually we stopped asking. Marcus absorbed this, feeling the weight of each accusation. Kelly, he said gently, talk to me about last night. Kelly wiped her eyes. I was at the end of a 14-hour shift. I was exhausted. The waiting room was packed. You looked stable, well-dressed, coherent, standing. I made a judgment call based on limited information and too many patients. The stroke patient, Mrs. Henderson, she said headache and dizziness. I asked if she had a history of migraines. She said yes. I didn't do a full neuro exam because I didn't have time. The child, I took the mother's word on the fever and didn't verify. I was moving too fast and I missed critical details. Because you were the only triage nurse for 63 patients. Yes, Patricia was supposed to send relief, but they couldn't find coverage. Patricia nodded. I had 3 nurses call in sick. We're running on skeleton crew. I made the call to keep Kelly on triage, even though she was past her shift limit. Marcus looked at each of them, exhausted, overworked, trying their best in an impossible situation. And he'd built that situation. Here's what's going to happen, Marcus said. Starting today, I'm initiating a comprehensive review of emergency services, not a witch hunt, a real assessment of what we need versus what we have. We'll bring in outside consultants, we'll survey every staff member anonymously, and we'll rebuild based on evidence and need, not budget constraints. The board will never approve the funding, Jeff said. Then I'll find it somewhere else. Cut administrative salaries, including mine, redirect funds, apply for grants. But this gets fixed. Marcus paused. And if the board won't support it, they'll need to find a new director, because I won't continue to oversee a system that nearly killed me. The room was silent. In the meantime, Marcus continued, immediate changes. No more 36-hour shifts, period. We'll hire temps if we have to. Minimum 2 triage nurses at all times. Waiting room monitoring every 15 minutes documented, and an open-door policy where anyone can report safety concerns without fear. That will cost millions, Patricia said. Then it costs millions. What's the alternative? We already have potential lawsuits. The legal costs will be substantial. Better to invest in prevention. Sarah Chen was nodding. When do we start? We already have. Dr. Chen, I'm putting you in charge of the waiting room monitoring protocol. I want a detailed procedure written by end of week. You'll also work with Kelly to revise triage protocols. I'm being allowed to stay on triage? Kelly asked. You made mistakes in an impossible situation. If I fire every person who makes mistakes, I'd have to fire myself first. What matters is whether you learn. Will you? Yes, she whispered. Then you stay. But you'll undergo additional training and work with a partner. Fair? More than fair. Marcus looked at Jeff and Patricia. You two will work with me on the comprehensive review. I need your expertise and your honesty. Can you do that? They both nodded. Good. Marcus leaned back, exhausted. One more thing. I want every patient who was in the ER last night contacted personally, not by a lawyer, by a physician. We're going to be transparent about what happened, apologize where appropriate, and explain what we're doing to fix it. That could open us up to massive liability, Jeff warned. Probably, but it's the right thing to do. Marcus met each person's eyes. We're medical professionals. We took an oath. Part of that oath is acknowledging when we fail. I failed last night. I won't compound that failure by hiding from it. Helena spoke up. Marcus needs rest. You all should get some sleep too. We'll reconvene tomorrow evening, 7 p.m. Bring your ideas and concerns. They filed out, each pausing to offer words of support. When the room was empty except for Helena and Marcus, she pulled her chair closer. You know the board might actually fire you for this. I know. And you're doing it anyway. I have to. Helena, I nearly died last night because of decisions I made or failed to make. If I don't fix this now, when will I? When someone actually dies? Helena was quiet. You're right. But this is going to be brutal. Good things usually are. Marcus closed his eyes. Wake me if anything urgent happens. Otherwise, let me rest. I'm going to need all my strength for what comes next. As Helena slipped out, Marcus lay in the darkness, listening to his own heartbeat on the monitor. Steady, strong, alive. He'd come terrifyingly close to becoming a statistic, but he'd survived, and now he had work to do. Outside, Chicago was waking up. Another day, another chance to do better. Marcus intended to take it. 6 weeks later, Marcus Webb walked through the automatic doors of Northwestern Memorial's emergency department. His abdomen still twinged, and he moved with deliberate care, but the danger had passed. It was 7 a.m. on a Tuesday, the shift change hour. Marcus had chosen this time intentionally. The waiting room had changed. New chairs, cleaner and more comfortable. A large digital board displayed estimated wait times in clear language. And most importantly, a nurse sat at a dedicated station facing the waiting area. The nurse looked up. Dr. Webb, welcome back. Thank you, Denise. Marcus had made it his business to learn every staff member's name. How's the morning looking? 12 patients currently waiting. Longest wait time is 38 minutes. Chest pain case we're monitoring. No critical deteriorations overnight. She gestured to her clipboard. The new monitoring system caught 2 patients who needed escalation before they became emergencies. It's working. Good. Keep me updated. The changes were everywhere. New equipment gleamed. The crash cart had been replaced. Digital monitors displayed real-time staffing ratios, and most significantly, the energy felt different, more focused, more intentional. Kelly Morrison was at the triage desk, but not alone. Beside her sat Marcus Chen, an experienced nurse they'd hired to implement the dual triage system. "Morning, Dr. Webb," Kelly called out. There was still a shadow in her eyes, guilt that hadn't fully faded, but also determination. "Morning." How's the new system working? It's an adjustment, Marcus Chen admitted. Takes longer to process patients, but we're catching things we would have missed. Yesterday, Kelly noticed subtle signs of sepsis in a patient, presenting with what looked like flu symptoms. We got her on antibiotics hours earlier. That's what I like to hear. He continued his rounds. In Bay 2, Sarah Chen was examining a patient with focused attention. She was still working long hours, but not dangerous ones. The new scheduling system capped shifts at 16 hours maximum. In the break room, he found Jeff Holden reviewing charts. "Marcus." Jeff stood, looking uncertain. "Didn't expect to see you back so soon. Doctor's clearance came through yesterday. Limited duties for another 2 weeks, but I needed to be here." Marcus poured himself coffee and sat down. "We need to talk, Jeff. If this is about my retirement, it's not. Unless you want it to be." Jeff had submitted his retirement papers 3 weeks ago, effective in 6 months. "I think it's time," Jeff said quietly. "I've given this place 23 years, but I'm tired, and I don't trust myself anymore. I walked past you that night. Twice. That's not the kind of doctor I ever wanted to be. You're a good doctor. You made a mistake in an impossible situation. I'd gotten complacent. We all had." Marcus nodded. "I accept your retirement if that's truly what you want, but I want you involved in the transition. We're hiring 2 new attending physicians. I want you to help train them. Pass on what you've learned, including the mistakes." "I can do that." Jeff managed a small smile. "I heard about the board meeting. Heard you threaten to quit if they didn't approve the funding." "Threatened and meant it. They approved it. Barely. But we have what we need now. Better staffing, better equipment, better protocols. Now we have to prove it works." "It's already working. The numbers from the last month are remarkable. Wait times down, patient satisfaction up, 0 critical incidents. You did it." "We fixed it," Marcus corrected, "and it's not done. Changing equipment is the easy part. Changing culture, that takes years." A knock interrupted them. Patricia Williams entered, followed by a man and woman. The woman was in her late 40s. The man was younger, with Tyler Martinez's eyes. "Dr. Webb," Patricia said, "this is Maria and Carlos Martinez, Tyler's parents." Marcus stood. "Mr. and Mrs. Martinez, thank you for coming. Please, sit." They sat, tension visible. Marcus had reached out to them personally 2 weeks ago. They'd declined initially, but had called yesterday. "Dr. Webb," Maria Martinez said, her voice controlled but emotional. "We've been thinking since that night. About Tyler, about the hospital." "I understand. And I want you to know that I take full responsibility." "Let me finish, please." Maria held up a hand. "We were angry. We are still angry. Our son nearly died because no one was watching him, and we considered suing. That's absolutely your right. But then we talked to Tyler. Really talked to him about why he was drinking, what's been going on." Maria's eyes filled with tears. "We'd been so focused on our jobs. We didn't see that our son was drowning, just like you didn't see him in your waiting room. We all failed him." Carlos spoke up. "Tyler told us something. He said while he was lying there, he heard you standing up, telling them he'd stop breathing. He said you saved his life even while you were dying yourself." "I was just doing what should have been done all along." "Maybe, but you did it anyway. And then we heard what you've been doing since. The changes, the money you fought for. You didn't hide from it, you fixed it." "We're fixing it," Marcus corrected gently. "We want to help," Maria said. "We talked to our lawyer and we're not going to sue. But we want to work with you. Tyler's going to be okay. He's in counseling now. But we don't want what happened to him to happen to anyone else. So we want to volunteer, maybe join some kind of patient advisory board." Marcus felt emotion tighten his throat. "We don't have a patient advisory board yet, but we're going to, and I'd be honored to have you as founding members." They talked for another 30 minutes. When the Martinezes left, they shook Marcus's hand with genuine warmth. "Thank you for meeting with them," Patricia said. "I know that was difficult." "It was necessary." Marcus checked his watch. "I need to make another stop. Is Mrs. Henderson still in rehabilitation? Fourth floor, room 4012. Marcus took the elevator up. Eleanor Henderson had survived her stroke, but the delayed treatment had cost her right-sided weakness, speech difficulties, months of rehabilitation ahead. He knocked gently. Mrs. Henderson, it's Dr. Webb. May I come in? Come in, a younger woman's voice called. Eleanor Henderson was in a wheelchair by the window. Her daughter Jennifer stood beside her, protective and wary. Eleanor turned her head slowly and regarded Marcus with sharp eyes. Dr. Webb, Eleanor said, her words slightly slurred but understandable. The man who almost died with me. Not quite the same circumstances, but yes. Marcus pulled up a chair. I wanted to check on you personally and apologize for what happened. Your nurse already apologized. So did the other doctor. You here to tell me not to sue? No, you should sue if you feel it's warranted. What happened to you was unacceptable. Huh. Eleanor studied him. Jennifer, this is the man I told you about. The one who fixed the emergency room. Jennifer's expression remained skeptical. My mother sat in your waiting room, having a stroke for 53 minutes. She has permanent damage. No amount of fixing changes that. You're absolutely right. It doesn't. And I can't undo what happened, but I can make sure it never happens to anyone else. Marcus looked at Eleanor directly. Mrs. Henderson, I failed you, as the person responsible for ensuring that emergency department functions properly. I'm deeply, truly sorry. Sorry doesn't give me back my right arm, Eleanor said, but her tone had softened. No, it doesn't. But maybe this will mean something. Your case has become a teaching example in our reformed protocols. Every triage nurse who goes through our new training hears your story. They learn about the subtle signs of stroke. Your suffering is preventing others from suffering the same way. Jennifer's eyes filled with tears. That's supposed to make us feel better? No, Marcus said gently. Nothing makes this better, but it's all I have to offer. Your mother's case exposed catastrophic failures. We've fixed those failures. We'll never fix what happened to her specifically, but we're preventing it from happening to others. Eleanor was quiet for a long moment. I was scared, she finally said, sitting there, feeling my face drooping, my words not coming right. I knew something was very wrong, and no one saw me. I'm so sorry, but you know what? I heard about you standing up that night, heard you called out everything that was wrong while you were dying. That took guts. Eleanor managed a lopsided smile. Jennifer, I want you to hold off on the lawsuit for now. Mom, just for a few months. Let's see if the changes stick. If this man is serious, we'll know. If it's all just show, then we sue. But I want to give him a chance. You don't have to do that, Marcus said. I know. But I'm going to anyway, because I'm also a retired nurse. I know how systems fail, and I know the difference between someone who's covering their ass and someone who's genuinely trying to do better. She pointed a shaky finger at him. But Dr. Webb, if I find out you were lying, I will sue you for everything you have. Understood? Understood. And I promise you, it's real. As Marcus left, Jennifer followed him into the hallway. Dr. Webb, wait. He turned, expecting anger. Instead, she looked exhausted and sad. Take care of my mother's dignity, Jennifer said quietly. That's all I ask. Don't let her become just a statistic. Remember she's a person. Remember her humanity. I will. I promise. Marcus's final stop was the hospital auditorium, where the afternoon all-staff meeting was being held. The room was packed. Helena Morrison was waiting at the podium. As Marcus walked to the front, the room fell silent. He didn't use the podium. Instead, he stood in front of it. 6 weeks ago, Marcus began, I almost died in our emergency room. I'm not here to rehash details or assign blame. I'm here to talk about what we've built. We increased staffing by 30%. We implemented dual triage and mandatory waiting room monitoring. We capped shift hours and improved equipment. We created anonymous reporting channels. We established a patient advisory board. And most importantly, we changed our culture from one that covered mistakes to one that learns from them. These changes cost money, they've been disruptive, but they've also saved lives. In the 6 weeks since we implemented the new protocols, we've prevented 4 critical deteriorations, caught 3 subtle diagnoses that would have been missed, and reduced average wait times by 32%. The system works, but only if we all commit to it. What happened 6 weeks ago wasn't just about me. I was lucky, I survived, and I had the power to force changes. But how many patients before me didn't survive? We'll never know the exact number, but we know it wasn't 0. Every patient who walks through those doors deserves our best. Not our stretched-too-thin best, our actual best. And now, finally, we have a system that makes that possible. Not perfect, but better. So I'm asking you to stay committed to these changes, even when they're inconvenient, even when they slow you down, because the old ways nearly killed me, and they did hurt others. We can never go back to that. I also want to address the lawsuits and scrutiny we're facing. Yes, there are potential lawsuits. Yes, we're facing scrutiny, but we will not let legal concerns drive us to cover up what happened. We're going to face it honestly and prove through our actions that we've genuinely changed. If you're asked about that night, tell the truth. If investigators want to interview you, cooperate fully. We have nothing to hide because we're not hiding. Finally, I'm proud of what we've built here. Not proud of how we got here. That night was a failure at every level. But proud of how we responded. We could have minimized and moved on. Instead, we tore down a broken system and rebuilt it correctly. That takes courage, and every person in this room has shown that courage. Thank you for your dedication and your willingness to do the hard work of genuine transformation. Northwestern Memorial is a better hospital because of you. Now let's keep it that way. The room erupted in applause, genuine emotional appreciation. Marcus saw tears on several faces. As people filed out, many stopped to share their stories or express support. Kelly Morrison approached with red-rimmed eyes. "Doctor, Webb, I just wanted to say, what you did reminded me why I became a nurse. I'd forgotten. I was just getting through shifts, checking boxes. But now I remember, I'm taking care of people, real people who need me to see them. Thank you for giving me that back." After she left, Helena joined Marcus. "Hell of a speech," she said. "Hell of a 6 weeks. How are you feeling, really?" Marcus considered honestly. His abdomen still ached. He was exhausted. He was facing potential consequences. "But underneath all of that, I'm okay," he said finally, "better than okay. For the first time in years, I feel like I'm doing medicine the right way, not managing it, actually doing it, protecting patients, fixing what's broken, making a real difference, even if it costs you your career. Especially if it costs my career, because if I can't do this job with integrity, I shouldn't be doing it at all." "Ma'am?" They walked through the hospital corridors, past the emergency department with its new protocols and renewed purpose. "You know what the strangest part is?" Marcus said. "I'm grateful, not for almost dying. That part sucked, but for the clarity it brought, for understanding what my patients experience, for seeing my own institution with fresh eyes. Most people wouldn't see near-death as a gift. Most people don't get to turn near-death into meaningful change." Marcus's office was as he'd left it 6 weeks ago. The budget reports sat on his desk. He looked at them now with different eyes, seeing not just numbers, but the human cost behind every line item. He pulled up the emergency department dashboard. Wait times, patient satisfaction, staff ratios, everything was green, not perfect but functional, safe, better. His phone rang. The board chair. Marcus took a breath and answered. "Dr. Webb, we need to discuss the latest accreditation report." The work continued. It would always continue. Healthcare was an endless battle against chaos and human fallibility. But that was exactly why the work mattered. Marcus Webb had almost died learning that lesson, but he'd lived to apply it. Outside his window, Chicago stretched toward the horizon. Millions of lives, each one valuable, each one deserving of care. Northwestern Memorial's emergency department would never be perfect, but it would be better. That was enough. The hospital director had waited in pain for 40 minutes. Then he'd stood up, spoken truth, and rebuilt something better. And that was what leadership actually meant.